Doctors are still prescribing codeine for children despite some safety concerns.
Researchers say the drug can be fatal in some cases to some children and may be ineffective in other cases. So joining us now, Dr. Garrett Peel, board-certified general surgeon from the Private Clinic for Surgical Care, to let us know what to watch out for when we're getting these prescriptions. Thanks so much for joining us.
Good morning.
Good to see you.
So codeine is a very common drug. In fact, at least since last year, codeine is prescribed to children a lot.
Yeah.
Now, what kinds of medicines are we talking about? Where is it prescribed?
It's prescribed usually for cough and colds and also for patients who have had surgery, specifically tonsillectomy. However, in the past several years, we've seen an upspike in overdoses and deaths. In fact, there have been 11 children who have died from codeine overdoses. And so the FDA has outlawed codeine to be given in any case in a child 18 or younger for a tonsillectomy.
But the fact is that even though it's outlawed, we're still getting it.
We are, and so we need to educate the public and educate our fellow physicians that codeine is a very dangerous drug.
Sure.
And this is why. Our bodies metabolize in the liver. We metabolize the medication usually in the liver. Some people have a genetic trait that does not allow them to metabolize in the liver. And so when they get codeine, our bodies convert it to morphine. And we all know morphine. Morphine is the IV drug.
Right.
And for some of these children, they don't have the specific enzyme to convert it to morphine and then break it down. So they convert it to morphine, and then they just get more morphine and more morphine and more morphine.
Does that come with age, or does that come with just specific
it's
children?
genetics. Yeah, it's certain children. In fact, we think about 56 to 65,000 children in this country have that genetic trait.
Now, I find it hard to believe as a mother that somewhere, I mean, either the physicians, the pediatricians, or even the pharmacists would say, you know, question it if it's really this lethal.
Right, and that's why recent studies have really tried to pinpoint this message. Do not use codeine, okay? Even if you're over the age of 15, 12, it is an issue along the entire spectrum of children, especially. For adults, we have some compensatory reserve, and we can basically fight that even if we have a genetic trait. But for children, they go down quickly, especially from a respiratory standpoint. Morphine can cause respiratory depression and death very quickly if you have an overdose. And we certainly hear of adults getting an overdose, but children are much more susceptible because of the genetic trait.
Now, will parents know that they have that trait and then kind of know that they shouldn't?
It's hard to know.
Is it? Yeah.
It's hard to know unless there's certainly an issue with previous medications. But what to look for? Look for your child to have pinpoint pupils, to be lethargic, to essentially have agitation very quickly, and then also stop breathing. Some children have just stopped breathing after 1 or 2 doses of this medication. So the Academy of Pediatrics has said, look, let's just say we're not going to recommend medication at all for the common cough and cold, and they've started to recommend honey in children 6 months or older. So that's a great safety concern for the entire population of physicians in this country right now.
So why do they even prescribe it? Are the other medications that are out there just not as effective as these with codeine? You
know, habits are hard to break, and as physicians we practice, and we get in a groove of prescribing certain medications for certain things, and so that's why education to our families and to our physicians are so important. Codeine is not an acceptable drug in children.
Okay, but you wouldn't maybe know that unless you do ask your physician. So you're recommending ask them as they get that prescription, hey, does this have codeine in it? Do I need to be worried?
Correct. And then especially if you're having a tonsillectomy. If your child is having a tonsillectomy, please do not fill the prescription for codeine.
Yeah, that's 18 and under. That's it doesn't matter if they're 16, 17, whether you think they can handle it okay.
Black box warning.
Black box warning. I like that. Wow.
Good
Pretty
advice.
Interesting stuff.
Yeah.
And a little scary at the same time. Yeah, it is.
Yeah. But with good education and good communication with your doctor,
yeah, and I think sometimes parents are afraid to ask the physician because they don't want to seem rude or like they think that the physician doesn't know what they're doing.
And really, you should take control of your own health care and ask questions, especially when your doctor is starting a new medication. Ask about, how is this going to impact my life? How is this going to impact my sleep? How is it going to impact my eating? All of the daily life things. And plus, is it going to interact with the other medications that I'm on? There's so many people on such a long list of medications we see every single day, and it really is important to take the time to look at the medication list and make sure we're not making a dangerous choice
Yeah.
for our patients.
And as a doctor, you would say there's no bad questions, right?
Never a bad question.
Never a bad question.
Better
right.
that you ask it than not.
Absolutely,
Okay,
sure.
especially when it comes to our children. All right, thanks so much.
Great information.
Have a
Thanks,
wonderful
Dr.
day.
Peel. You as well.
too.
Coming up on Daybreak, why Justin Bieber is in trouble with the law against